My name is Dr. Eckes. I'm a bariatric surgeon, and I want to talk today about a very common question. And that question is, how do some of the new medications that are out there now, including Wegovy and Ozempic, compare to surgeries like gastric bypass and sleeve gastrectomy? I think we're in a very amazing time right now. I think there's some very new, promising medications out there that are trying to mimic the effects of weight loss surgery. And luckily, we have some pretty good papers and data out that can help give us a little more insight on what patients may want to choose to do. So first off, let's talk about some of the new game-changing medications that are out there. This is a Wegovy pen, and it does have the medication called semaglutide in it. And this medication basically tricks your brain and your stomach into feeling full. So now when you eat food, you get fuller quicker. Another medication out there called Mounjaro has also been released not too long ago. And this medication also acts on the glucagon-like peptide, but also acts on another molecule called GIP, which is a gastric inhibitory peptide. All these medications, they try to trick your brain and your stomach into feeling that fullness that you get. So luckily now we have some good studies that can help break these things down. And one of the biggest studies that we found came from the New England Journal of Medicine, and that was in February 2021. And basically they took these medications and they compared them. And it's a great study because it's what we call a double-blinded study, where the participants and the people that were administering the medications didn't really know what the patients were getting. And this involved almost 2,000 patients, and patients were differentiated into a group of patients that got medication and ones that got a placebo. On average, we had some pretty promising results, and the study comprised of patients, mostly women, about 3/4, with a BMI of 30 or a BMI of higher than 27 with medical problems. And what they found was they looked at a very long data point at about 68 weeks, or about 1 year and 4 months afterwards, and they found that the average weight loss was 14.6% of the initial weight loss. Now, it's important to remember that some people did better, some people did a lot worse, but the average weight loss was about 14.6%. When you compared it to the placebo group that didn't get any medication, that only lost about 2% or so. Mounjaro is another medication, and again, we think because this acts on a separate receptor as well, average weight loss with that medication is a little bit more, and we're thinking about 15% at 68 weeks. So again, good studies, large population groups, but the question is, again, how does this compare to weight loss surgery? So a couple things to know. Weight loss surgery is a permanent change, and it does require a lifestyle commitment. The benefit with weight loss surgery is it's done once in most cases, and there is a much higher, more profound effect and significant long-term weight loss. Now, traditionally, some of the most common prescribed medications were phentermine, which only had about a 7.5% weight loss and can only be used in short spurts because of the side effects. So compared to semaglutide, which has much higher weight loss effects, it's a promising thing. But surgery has also been around much longer than these medications. And some of the concerns that we have in healthcare is what's going to happen 20, 30, 40 years down the road, because we know that there are some side effects with these medications, mostly nausea, vomiting, but in other studies they can have pancreatitis. So we don't quite have 20, 30, 40, 50-year data that we do in some of these other weight loss surgeries. And of course, the other thing to consider is the cost. The cost of these medications can be exceedingly high. So Wegovy, for example, or Ozempic costs about $950 a month. So if you space that out over 10 years, you're talking about almost over $100,000 worth of medications that you have to do. And we know while the medications do work great, the companies do want you on it for life. And once we stop these medications, we think people usually end up regaining about 80% of the weight that they lost. And that compares to about, the cost of a sleeve gastrectomy or gastric bypass, which is about $20,000 or so, which is a one-time fee that doesn't need shots weekly, that doesn't need maintenance. And when you look at the data, weight loss surgery is still far superior to what we can achieve with these medications. So if you look at the actual data, for example, on average, people that undergo weight loss surgery, for example, a sleeve gastrectomy, lose about 29% of their um, uh, total weight loss, which is double that of what you see. So it's a very important thing to consider. Do you want to be on a medication for the rest of your life, technically, or do you want to undergo a surgery once that is invasive and, of course, does have its own risks? Now, we think an experienced hands weight loss surgery like a sleeve gastrectomy only has about a 1 to 2% risk of a serious complication, and other surgeries like a gastric bypass, about a 5% risk. Now, again, it's a big decision to make. Medication, surgery, and I think there's a role for both, depending on the patient. And these are the kind of things that really has to be assessed with a professional to see what your risks are, what your benefit are, before making a decision. So, again, on average, we know that about 75% of people that take some of these medications have some side effects, and usually that's kind of mild, like diarrhea, bloating, but can be other more severe things. So a lot to consider. Very interesting to have the ability to provide both these services for patients. And I think that ultimately the data is going to even get better to help us determine what might be best for our patients. But as of now, considering the cost, considering the benefit, I think we still know for a fact that weight loss surgery is just superior to the outcomes that we do get. But of course, the risk of having a permanent surgery is there. And for some patients, surgery is a better option. And for some patients, I think medications are a better option, and sometimes together. So further data is going to come out. But for many, many patients that are struggling with their weight, that have failed the long-term diet and exercise program, I think we have great tools out there for you, but please talk to a professional about what might be best for you. Thank you.